But I wanted to talk a little bit about why you or your doctor, or whoever you talk to about hormones, may have potentially a skewed view on HRT and where it comes from. And hopefully, this is going to arm you with either some talking points. There'll be some research for you to be able to review and print out if you'd like, and we'll try to do a TLDR, a too long didn't read summary of this conversation as well. All right, so let's talk about kind of let's go back to the start. Let's start at the bottom, and now we're here. So the early history, let's say, of hormone replacement therapy started with this book in the 60s. It was called Feminine Forever. You can still buy it on Amazon, unbelievably. And the book essentially um, advocated this idea that women should take estrogen forever. It's the fountain of youth, as the title suggests, you're going to be feminine forever. And of course, we know that that's not true. And later we found out that this doctor he had conflicts of interest in writing the book. He was paid untold sums of money by the drug company who was making estrogen. Where have we heard that before, ladies? So there's the conflict of interest, but of course he has some letters behind his name that give him sort of a cultural authority, and off we went. So estrogen, and then of course what we started seeing is just the application. So in the 70s, just the application of estrogen caused quite a bit of uterine cancer. So I'm going to come back to that, because what we know now, of course, is when we combine estrogen and progesterone, that sort of nullifies that risk. But I want to get back to I don't want to get too far off topic. I want to talk a little bit about what we know about estrogen. So estrogen in and of itself is not bad, right? It can relieve and does relieve many of the symptoms of menopause. So it's not just the hot flashes, it's not just the night sweats, but the palpitations, like sometimes we often see in late perimenopause and into those early menopausal years, heart palpitations. We start to see this aura of brain fog, where you have no idea what you were saying, or you walk into a room, you have no idea why you're there. Depression, joint pain, muscle aches and pains. And I put this on my Instagram. Gosh, it must have been maybe it's a couple weeks ago, maybe months. And I was talking about this clip that I saw with Oprah Winfrey, and she was basically describing that in her sort of perimenopausal and early menopausal years, I don't think she actually said her actual age, but it was sort of in that perimenopausal time that she started experiencing lots and lots of palpitations, and she thought that she was having a heart attack. So of course she goes to her cardiologist, who was female, by the way, and that's an important point. And they ran all the tests, and I think they ended up putting her on a medication. Which medication I can't recall. It might have been a statin. I don't recall what it was. It might have been a statin. I don't know if she mentioned her cholesterol numbers, but her female cardiologist thought that she had a problem with her heart, right? So this, atypical fibrillations or whatever, and put her on medication for it. It later became very obvious and very apparent that her heart palpitations were part of a larger cluster of symptoms that are associated quite strongly with menopause. And I put this up on my Instagram because I thought it was a, a something for all the women who are in their menopausal years to think about. So when we think about Oprah Winfrey, we think about wildly successful, rich beyond most of our dreams. And she has the access to resources that potentially you and I don't, right? So she has access to the best doctors, medications, facilities, etc. And my point with this post was, if Oprah's doctor, Oprah's female doctor, missed it, what is the likelihood that your doctor is not quite getting the full picture because of their own biases and the way that they've been instructed in medical school and in their training? And this is part of the reason why I do the why I produce this podcast is it's no longer a luxury for women to understand the signs and symptoms of perimenopause. It is a necessity. You need to also be an advocate for your health. You need a physician who is going to advocate for you and has the ability and has the knowledge and the wherewithal to get their diagnosis right. But you also, as the patient, you also, as the, we'll say the boss, if you will, of your healthcare business. If healthcare was a business, you are the CEO, let's say, right? Like you are the boss. You have to also understand how things work. You may not necessarily need to know all the intricacies, right? So you can delegate that to your doctor or have a conversation with your doctor, but it is no longer a luxury for us to just sort of be, you know, delegating all of our health decisions to our doctors because many times they don't know themselves. And I say that with love for all of my medical doctors who are my friends. I say that as a healthcare practitioner myself. If I were to pretend that I know everything, like please stop listening to the show because I absolutely don't. And it would be hubris. It would be beyond arrogant for anyone to think that they know it all. And so it just something for you to gnaw on there.